right, welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Arti Lal. She's a pediatrician. Today's KevinMD article is Why ADHD in Women is Finally Getting the Attention It Deserves. Arti, welcome to the show.
Thank you, Kevin. Glad to be here.
All right, so just briefly share your story and then talk about why you decided to write this article.
I'm Dr. Arti Lal. I'm a career pediatrician in Austin, Texas. I work for Baylor Scott and White, and I have been diagnosing and treating patients with ADHD, including children and young adults, for the past 14 years. It has been quite an interesting and fulfilling journey.
All right, and your article focuses on ADHD in women. Why did you decide to write this article?
Yeah. The purpose of writing this article was mainly because the landscape of ADHD has changed somewhat in the past few years, and we have seen more and more women coming forward for assessment and diagnosis. And the reason for that is, I think the pandemic threw that door wide open. More and more people were isolating socially. There was more self-reflection. I think family members were in close contact with each other. And there was a process of also accessing, social media much more, Instagram, TikTok, and people were posting more about the topic. And more, I think girls and women started seeing themselves in those, in the social media posts. And I think they started coming forward for, getting professional assessments and help and advocating more for themselves that, hey, this could be ADHD, the lifelong symptoms that we have been suffering from. And we actually saw the rate of ADHD in women almost diagnosis and need for assessment almost double from 2020 to 2022.
In your article, you talk about the presentation of ADHD being different in women versus men. How does ADHD present differently in women?
Yeah. So, ADHD is a complex disorder, and the types in the most recent DSM-5 are three. There's a combined type with hyperactivity, impulsivity. There's one and inattention. There's just the hyperactive impulsive type, which is actually quite rare, and the inattentive type. Now, both types can present in both men and women, boys and girls. But in women particularly, the inattentive type tends to be more common. And hyperactivity in women is slightly different from hyperactivity in men, where, it is more, especially in boys, it is more apparent, they're the usual rambunctious boys in the classroom. It's very visible, they walk around the classroom, won't listen to the teachers. But in girls, it is somewhat hidden in that they tend to be more restless, fidgety, talkative. There's rapid speech. And so this is not, completely apparent to parents and teachers. And so the hyperactivity aspect differs a lot between girls and boys and men and women.
How do you assess ADHD in the exam room? In your article, you talk about perhaps some objective testing, but give us the approach of how you would diagnose ADHD when someone presents with you with potential symptoms.
Yeah. So, ADHD, like I said, is a complex disorder, more complex than I thought what it was when I started this journey several years ago. And basically, the process involves, number one, taking a detailed history, and the history includes educational history, medical history, history of, the family dynamics, then sleep, diet, exercise, and any other medical issues that you may have. So it's quite a long clinical interview. And basically, you're looking for cause and effect.
Mm-hmm.
You're looking for, hey, is this disorder truly the ADHD the way I understand it? Or is this something that is coming from something else? For instance, I'll give you an example. Last year, I had a patient, 13-year-old, who had a lot of recent weight loss, was very hyperactive in the classroom, had a lot of tremors, was very restless, which he wasn't 6 months ago. And he turned out to have thyroid issues. So you really have to, be a detective looking for all kinds of things that may aggravate ADHD or cause secondary ADHD, or maybe may or may not be ADHD. Secondly, we do some rating scales, anxiety rating scales, depression rating scales that are appropriate ADHD wise, depending on the age of the patient. Then we add in other rating scales like for eating disorders, OCD, depending on the history, whatever is present, again, to rule out, cause and effect. Lastly, objective testing is basically a 20-minute computerized test, which we do that gives us a measure of, and a very visual and data-driven measure of exactly how your attention is and how much impulsivity and movement you have when you're given a task. So it has been an extremely useful tool to really graphically show the patients and to tease out, overlapping diagnosis. And it's also helped with treatment. You can put the patient on medication, you can repeat the test and actually see the changes.
One of the things that I found interesting about your article was a link between estrogen levels and ADHD symptoms in women. So, can you walk us through how these symptoms might change for a woman throughout a menstrual cycle?
Yes. Surprisingly, estrogen is produced by the brain itself, not just the ovaries. And the estrogen that is produced from the cholesterol in the brain is responsible for regulation of dopamine receptors, regulation of serotonin and norepinephrine. And hence, you can imagine what happens when estrogen goes up and down, right? It can affect, women in 3 or 4 phases of their lives and recurrently so. Imagine a young woman who's having a menstrual cycle and in the post luteal phase, premenstrually, when her estrogen drops and progesterone goes up, you'll definitely see inattention, memory issues, cognitive decline. And they say that actually girls and women with ADHD are affected more than the general population of women. Also, in the postpartum phase, women have, it's speculated, we really don't have the research, and the research is being, done now by several ADHD researchers. And what they say is that postpartum depression is more in women, perimenopausal symptoms in women who have ADHD have much more brain fog, attention and memory issues, and mood issues. So I think hormones have been entirely left out in 50% of the population, and we're only coming to that now, and I'm very glad we are actually.
Now, do you think the way that we screen and diagnose for ADHD does that need to be adjusted so perhaps we can ask more gender-specific questions to screen girls who may have been missed by traditional methods of screening?
Yes, absolutely. What we see in the previous rating scales, and the rating scales have evolved in the 60s, 70s, and 90s. And I was actually looking at an older rating scale, the Connor rating scale, which had about 59 questions, and only 7 questions were devoted to inattention. And the questions are not specific to circumstances that you see in day-to-day life. They were very general. So it really misses on that huge part of ADHD which is present in girls, that is inattention. So I think a lot of work is being done in that area. I'm actually part of 1 or 2 of those studies where we are trying to find more and more tools so that we don't miss this in girls and women.
What about the treatment of ADHD? Are there any differences in terms of how we treat ADHD in girls versus boys?
Uh, Generally over the past several years, treatments have by and large been the same.
Hmm.
And I mean, treatment includes, of course, psychoeducation is a tremendous one, stimulant medications and non-stimulant medications. Studies have not shown any differences in effects on girls and boys and men and women. They have the same effects. And also, non-stimulants have really come into the picture in a big way in the past few years. But the way going forwards we can help girls and women more is by paying attention to their menstrual cycles, the phase of the menstrual cycle, and their hormones, basically. So we can really, I think, now craft treatments, and we have already started doing that. And actually, there was a report that women had already started varying the dosage of their stimulants in different phases of their menstrual cycle themselves and not telling their clinicians. So you're absolutely right. We can do hormonal replacement therapy. Some women have even gone on HRT for, 3 months at a time so that you don't have a period, so you don't have the inflections of the hormones.
Mm.
You can also add a small dose of SSRIs. You can vary the dose of the stimulants. And so there is absolutely a lot that can be done now.
So you've seen some women vary the dose of their stimulants based on where they are in the menstrual cycle?
Yes, not myself, but there are reports of that.
Now, how do you counsel women during their menstrual cycle in terms of managing their ADHD symptoms?
Yes. So, I mean, I have to admit, Kevin, this has started only recently because all this is coming to light recently. I wish I had known this before and had all this knowledge and thought about it, and known more about the effects of estrogen on the female brain. But now I have started talking to them about, charting their symptoms,
Mhm.
giving me feedback about if it does, if they have cognitive changes, memory issues, and more inattention, then, I add a small dose of a short-acting stimulant to help them through those days. I haven't delved into HRT yet, but I think that would be a good one where if a woman is already on birth control, instead of her doing a 28-day cycle, then coming off it and having a period, I can probably put her on a 3 monthly, 84-day cycle and avoid that dip down in her cognition.
Another point that you raise in your article is the lack of data or research in ADHD medicine during pregnancy. So, how do you counsel women who have to manage their medications and are pregnant?
Right. So I think there is some data that has come out recently that some stimulant medications may be safe during pregnancy. And like I said, Kevin, again, I think in the past, when I've had young women who were pregnant, we didn't have enough data about how safe these medications were. And so I would definitely tell them, hey, please avoid in the first and second trimester. We don't know about fetal malformations, etc. In the third trimester, maybe if they were really having a difficult time, we would do it as needed and only a short acting one so that the half life is short and gets out of your system quickly. But now there is some data coming out about certain medication, mostly in the methylphenidate group, that may be safe to do. And the way that ADHD affects some of these women where symptoms are quite severe, I think it can really derail their lives. And we really have to rethink medications during pregnancy in women with ADHD.
We're talking to Arti Lal. She's a pediatrician. Today's Kevin MD article is Why ADHD in Women is Finally Getting the Attention It Deserves. Arti, let's end with some take home messages that you want to leave with the Kevin MD audience.
I think ADHD for a long time has been trivialized and stigmatized in both men and women, and more so in women. And I think we need more and more training of physicians, especially primary care and ADHD specialists, to see how ADHD affects women differently than men. We also need more tools to diagnose ADHD in women and specific to their circumstances. And I would say this to clinicians that, please start asking your patients about their symptoms. If they have ADHD and you're prescribing their medications and just doing medication follow-ups, I think this is very important. As well as something I will put out there is, I mean, having done ADHD for so many years and seeing the way it changed during the pandemic and how many women are coming out, I would at some point advocate even universal screening for
Mhm.
ADHD. We do universal screening for depression these days. And, I think we have to be more intentional about finding these patients and treating them and providing, equitable care and really, especially following up on accommodations with employers and being aware that this is covered under the American for Disabilities Act, and very small accommodations can have huge impact on patients' lives.
Arti, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you, Kevin.